Hi, everyone, and welcome to our monthly Advocacy Chat. I'm Rose Gerber. I'm COA's Director of Patient Advocacy and Education. And as you can see from the slide on your screen, we have an amazing speaker today. But before I introduce her, I will always take a few minutes at the top of the chat to give you some updates about what we're doing at COA and with CPAN. Like you, the rest of the country and the entire world, we remain very fixated on anything and everything to do with COVID. Our incredible community oncologists are continuing to do what they do best. They're taking care of patients in a very safe setting, accessible to these patients that are in treatment at a very tough time to be a cancer patient. Many of our oncologists and the nurses in these clinics have also been recipients of the COVID vaccine, which makes me so happy for them on a personal level and on a professional level. And of course, when I think about them on the front lines, it gets me thinking about all of you that work on the front lines, not just in the healthcare field, in any other field. And I'm so grateful to all of you. And I know that I'm not alone in my gratitude. But I do think about you a lot, especially as I sit safely in my home office. So deep thanks to you. Speaking of COVID, something very important that our organization did is our membership recently sent out a letter to the Governors Association as well as to key contacts at the federal level regarding our request that oncologists, these cancer providers in the community oncology settings, be given the ability to administer the COVID vaccine. And when you think about this, it makes perfect sense. Even before COVID, being a cancer patient in a cancer center, you're entering one of the most sterile, safe environments. And now that safety zone has increased dramatically. So we have issued that request. And also, as part of that request, that our oncologists be able to administer the vaccine, we've also requested that cancer patients be prioritized as recipients of the vaccine. We do know, especially when I say we, especially those of us who have actually been patients or those of you who are taking care of patients, you're at extreme risk for so many other things when you're going through a cancer diagnosis. So we hope that we see some traction on that. And again, we're working at across the country. Most specifically, one of the things that we did related to this request is we did a phone to action. We are doing a phone to action campaign in Florida, which I've mentioned many times before. When you think about Florida, there's 100 locations just within Florida Cancer Specialists. So CPAN, FCS, and Flasco, we all united to start this phone to action campaign, hoping to make some progress on some of these COVID requests. Also, unfortunately, what's happened through COVID is we've seen a dramatic decrease in cancer screening, and we've shared that with you in the past. In fact, we had Dr. Gordon, Ted Ocon, Dr. Deborah Pat come and talk to you about what they've seen, again, as frontline oncologists in real time. And also we had that backed up by research by Avalier. What we're doing is we're continuing to be very, very concerned about the decrease in cancer screening. So we are actively working on a screening campaign. So key members within COA, and we're also partnering with Cancer Care, and hopefully we'll have more good news to share with you, more updates on what's happening on the cancer screening front. So I cannot think of a more perfect guest, since this month is Cancer Prevention Month, than our very special guest, Carolyn Aldige. I have very high respect for her. I've been to many of her organization's functions. She's obviously at the forefront as a CEO and founder and knows exactly what she's talking about when it comes to prevention and screening. So it's my pleasure to introduce Bo. Bo, please. Next slide, please.
Rose, thank you so much. And it's just a real pleasure to be here with you today. I was so grateful that you asked me to do this chat, particularly during Cancer Prevention Month. We're thrilled that this is Cancer Prevention Month. I think it's the 17th year. I believe the Cancer Prevention, February has been designated Cancer Prevention Month since 2001. So it's actually the 20th year. So forgive me. Anyway, may I have the next slide, please? There we go. So this year happens to be the year we're celebrating our 35th anniversary. We were founded on the 1st of August, 1985. I'm getting myself all confused now. We were founded on the 3rd of December, 1985. My father died on the 1st of August of 1984, which happened to be my mother's birthday. And that was really the impetus for my starting the foundation, which a lot of people want to know, why did you do this? And that's the reason. And he died of what I considered a preventable cancer. So hence our focus on prevention and early detection, which has been our sole focus for the last 35 years and will continue to be. We've taken as a theme for our 35th anniversary, dare to imagine. And what are we daring to imagine? We're daring to imagine a world where no one dies of cancer. It's obviously a very aspirational theme, but we truly believe we can get there. We know that since 2001, between 2001 and 2017, the cancer mortality rate declined about 1.5% per year, which is really huge due to better screening, smoking cessation, and better treatments. So we do believe we can get there. It's going to take us a lot of combined effort and the efforts of all of us, but we can get to a world where no one dies of cancer.
Bob, I wanted, before you go to your next slide, I really want to give you so much credit for this. I don't know if you want to call it a tagline, a message. I know it's a bigger campaign, but it's very positive, dare to imagine. But then you do use the word die. And we know that we have so many cancer survivors. We're so happy. I mean, worldwide, the research a lot that your organization is doing as well. We tend to think of cancer as that everybody survives it. And that's great. A lot of people do survive, but like right now in real time, I know personally cancer survivors that are literally in the last days of their lives. And you started this organization because your dad died. And I think it's important that we do remember that people do die. So, congratulations to you for including this word, and it's still making it optimistic, because we don't want people to die, because it's still extremely sad. So thank you.
Rose, I think you make such a good point, and we recognize that people will continue to die of this disease. But as I said, it's an aspirational goal, and we just want people to imagine that this could happen. Yes. And how can it happen? Well, the best way to get there is through prevention and early detection. That's what we believe. Could I have the next slide, please? And so in order to do that, we set an interim goal, not a goal where no one dies of cancer, but we would like to see if we can reduce the number of cancer deaths by 40% by 2035. That's 14 years from now, and that will be our 50th anniversary. So we think that setting a bold goal, or several bold goals, to get us to this 40% reduction in mortality by our 50th anniversary will require a lot of investment. And so we have come up with 3 areas that we would like to, that we're committed to investing significant amounts of funds. So our first bold goal is that we will invest $20 million towards research in innovative early detection technology and advancing multi-cancer screening. And I'll talk a little more about multi-cancer screening later on, but the innovative technology, I just want to point out to you an example. And if you look to the left of that banner, you'll see a little pink and white device with a cell phone propped up behind it, just to give you an idea of the size of this device. That device is called an iBreast. And it is a device that was developed, which is battery powered, handheld, and can be used by a community health worker in particularly low resource countries that have villages where they have no electricity, much less access to mammography. And this device is cleared by the FDA. It's won awards. In fact, I was involved in one of them for innovation in cancer early detection. And it's being deployed all over the world. It has great potential even in this country, even in setting in countries that aren't necessarily low resource, but there are unfortunately parts of this country that are considered low resource. So the iBreast is the kind of innovative early detection technology we want to look into.
Well, I want to thank you too, and I want to share
Yeah.
something with our listeners that you shared with me yesterday when we were doing a little chit chat about some of our goals for today. I like to think I stay on top of what's happening in the breast cancer world because that's a personal interest to me. And I had never heard of this iBreast exam. And by the way, for those of you that want to learn more about it, you can go to their website, iBreast exam. But you talked about low resource, and that's something that we don't think about. So for all the survivors that have gone in and had a mammogram or an MRI. And if you haven't, you can do a quick Google. These are huge machines. They're absolutely huge. Like when I go in and get an MRI, that I always am struck by the size of it, and then the noise, dun, 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 dun. But when you talk to me about this device, it's so small. And when I was learning about it, because I was so fascinated, it said it's almost like a stethoscope. And it's really incredible that you have funded something like this because, again, not everyone has tons of resources and tons of money to buy these massive machines. So this is really incredible, Bo. Thank you for teaching me about that and teaching us about it.
Well, I'm so glad I was able to bring it to your attention because it does have an enormous potential around the world. And I just saw last week that breast cancer has now taken over lung cancer as the #1 most diagnosed cancer in the world.
Yes, and that was the World Health Organization that released that, so anybody can go look at that information too.
Exactly. Our second bold goal is to invest $10 million to expand cancer screening and vaccination access to medically underserved communities. And I'll talk more about that later too. But this foundation, since the late 80s, has had a commitment to expanding services in medically underserved commitments. We've had a commitment to health equity for over 30 years. So we are not kind of coming late to this party. It's a wonderful that it's now something that virtually every organization is thinking about. But our very first program was developed in 1989, and it was to increase health equity in breast cancer in 4 different communities across the country. And so it's been a very important part of what we've done for the last 30 plus years. Our third bold goal is to invest $10 million in public education, because if we have all this amazing technology and the public doesn't know about it, doesn't understand screening, doesn't understand vaccination and how certain vaccinations can actually prevent cancer, then we're not really helping. So we've got to get the word out. And we just think that's equally important contribution that we can make. So could I please have the next slide? So let me get back to this, what I referred to in the bold goals about multi-cancer early detection. And this is something that is on the horizon, but it is probably something that's going to happen in the near term. So what do we have now? We have essentially 5 approved tests for the early detection of cancer, for breast cancer, lung, colorectal, cervical, and prostate. And prostate is not even given an A or B score by the U.S. Preventive Services Task Force, but it is reimbursed and it is covered by Medicare. So you can screen with one test and screen for one cancer, or perhaps one test can find many cancers. And this is out there. This is imminent, this kind of technology. It's a blood test that when analyzed can detect signals of potentially up to 50 different cancers. Wow. And then of course there needs to be a diagnostic workup to see where the cancer might be that's giving these signals of cancer. But we think, we at the foundation are squarely behind this new technology. We really believe in its potential to help us find cancer early, And we all, I think, accept the fact that the earlier cancer is detected, the better chance someone has of a successful outcome. Mm-hmm. So how do we continue to get to this reduction of 40% in mortality by the year 2035? Well, this is one way we really believe is going to help us get there. And when you look at the list, and I certainly won't read it all, but think about how many of the cancers on this list are really among the most lethal cancers there are. Consider pancreatic cancer just as one. Ovarian cancer is another. So there's so many. Sarcoma is another really difficult to treat cancer. So the earlier cancer is detected, the better the chance of a successful outcome. I think that's really the bottom line. That's why, to us, early detection is such a key part of what we do. May I have the next slide? There is legislation pending. It was introduced in the 116th Congress. The bill is co-sponsored in on the Senate side by Senators Scott and Bennett. And on the House side, it was introduced by Representatives Sewell, Arrington, Ruiz, and Hudson. And this bill would actually provide for reimbursement by Medicare of multi-cancer early detection testing. So it will be reintroduced in the new Congress. It doesn't have a number yet, but we're getting there. And our foundation took the lead. Mm-hmm. The other document you see is a letter. We took the lead on developing this letter, advocating to the Congress for the passage of this bill. And I am really happy to say that as of this morning, we have 257 organizations that have signed on to this letter, which we're just amazed. I mean, it wasn't so long ago, it was it was just over 100 and we were thrilled, but now we've got 257. So clearly other organizations believe in this as well. And I would invite you, yeah.
Excuse me, I'm sorry. We both get so excited about the subject. I also wanted to, basically praise you for this bill, because we were also very happy to support it, both COA and CPAN. And something that really stood out to me when I was reading some of your early documentation is there's a lot of times there's like a misalignment between the science, which you just shared with us, this incredible science that's happening, and then access or reimbursement for the care. So, I mean, really kudos to you for that.
Thank you. And they just go hand in glove. I mean, why have these tests if they're not available and reimbursable? Yeah, right. Exactly. So it's just not right. It's not fair. And so we feel like this has to proceed down parallel tracks. And so mm-hmm. we're delighted the advocacy community has really come on board with us to say this is important and we've got to get it done. So, and it was apparently, and I know that a lot of work was done on the Hill before this bill, these two companion bills were introduced. And my understanding is it was just not a hard sell. Members of both in both houses of Congress really believe in this. So I think we'll see it happen sooner rather than later. May I have the next slide, please? I'd like to pivot now to some of the things that we have done to expand access to early detection technology in underserved communities. I mentioned that our very first program back in the late 80s was targeted particularly to African Americans who at that time and still are dying, have much higher mortality rate from breast cancer. And we learned from that pilot program that one of the biggest barriers to women's ability to get screened, to have a mammogram, was transportation. So we did some research in our nation's capital where we're based, and we thought, well, we're better to start, and realized that it was what was desperately needed. This needs assessment showed us was mobile mammography. And so we raised the money and gave a very large grant to George Washington University Medical Center to build and operate the very first mammovan. And this mammovan, since I believe it was, the first one was launched in 1996. It has gone all over the city, providing mammography to women where they are. It goes to community centers, it goes to housing developments, it goes to sometimes schools, churches. It just goes where the people are. And then the other key component, as you know, of any successful screening program is what's the next step if there's a positive finding. And I very much applaud GW for its commitment to always making sure that no one slipped through the cracks, that every single person was followed and it got to whatever diagnostic workup was needed or even treatment. And that's always been a critical component of any screening program we sponsor, is that there has to be a commitment on the part of the medical partner to provide treatment.
It's wonderful, Bob.
And I'm sure that COA is right on board with that kind of commitment. This program, we realized, was beginning to spend a lot of time in communities that were predominantly Latina, and that there was such a need for a Spanish-speaking program to address the needs of Latinas. And so in the next slide, please. This is a picture of a program that we have done in partnership with Catholic Charities at the Spanish Catholic Center in Adams Morgan, and then 2 other sites in Washington, as well as in suburban Chicago. But this is a program called Celebremos la Vida, or Let's Celebrate Life. And to date, we have screened, it's upwards of 20,000 women for both breast cancer and cervical cancer. And there have been a lot of diagnoses, I don't remember the exact number, but many diagnoses of early breast and early cervical cancer that likely would have remained undetected and progressed to advanced stages when they were much less treatable. But the program is taught in Spanish. There's always a Spanish-speaking navigator. We partner, as I said, with Catholic Charities, so there's the component of a faith-based institution, which is very important. So when we do any of these outreach programs to medically underserved communities, we really try to be sensitive to their needs and what works for them. And it has been just remarkably successful. It's been going on for 25 years.
Wow, that's great.
So, this is 1995, so it's 27 years now. I forget how far we are into the 2000s. I have one more example I'd like to show you, if I may, Rose, of
sure,
of a successful community outreach program. If I could have the next slide, please. And that is our community grants program. So not only do we develop and help implement programs that we come up with, we provide grants to organizations all around the country. And in fact, we have done several in low and middle income countries around the world, predominantly sub-Saharan Africa and South and Central America, where the rates of cervical cancer in particular are just devastatingly high. But our community grants program in the United States is all our grants are peer-reviewed grants. We have a panel who evaluates all the applications we receive, and every year we fund about 10 to 12 community grants. This one in particular is focused on lung cancer screening. Our grants are usually to small grassroots organizations around the country, but in this case, it's a major cancer center, but it is going into the local community and providing lung cancer screening to medically underserved individuals.
Bo, you know what's really amazing too about your organization is, I'm going back to your slide where you had the eye breast exam. And when you and I spoke, you said that the clinical, and correct me if I'm wrong on any of this, the clinical trial was conducted in Nigeria. but it was led by Memorial Sloan scientists, I believe. But you and I were
That's right.
talking about how you saw that there could be application here in the United States, particularly in rural America. And I think one of the things that COVID taught all of us is that we are all connected. It's not even up for debate. We are
So
all
true.
connected in some
That's
way.
right.
So you're doing everything from so many levels, at literally at the community level, but then globally. And that's really fascinating, because someone might hear the word Nigeria, or you're somewhere in some country, and a person might have a gut reaction. Well, why is the money going there? Because what we're learning is that it's applicable. We're all human beings. We all have the same exact body, and this can benefit everyone. So again,
You're so
both
right. Great observation, Rose. And I'm mindful of our time. I'm gonna go ahead and move to the next group of slides, and that is our third bold goal, which is to invest in education of the public about screening and vaccination. So the program we developed in response to the pandemic is called Back on the Books. It's a public education campaign. It was informed by some market research that we did back in May and again in December. And it has been remarkable at garnering media attention. We've had a story in USA Today. We've been on many local TV stations, local news. And finally, we had a letter to the editor in the Wall Street Journal back in October, and then another one, which turned out to be the lead letter on January 20th, about this program, Back on the Books, and about the devastating impact of postponing and canceling cancer screenings because of fear of COVID. And I think we, the cancer community, I know COA thinks it's really important as well. We just are encouraging people and trying to educate them that these environments are as safe as practically anywhere you can go. If you go to the grocery store, you can go to a mammography center and get your mammogram. You can get your cancer screenings back on the books. And we don't want people dying of cancer unnecessarily because of missed or delayed screenings. And that really is what's happening. The next slide shows an example of another program we've done, which has been going on about 5 years. So this was not done in response to the pandemic, but it was done in response to the abysmally low rate of vaccination for HPV and for hepatitis C. So these are two viruses we know that can cause cancer. And if you get screened and treated, or vaccinated, screened, and treated for these viruses, you can avoid cancer. It's such a simple message. And it's just one that the situation, it just shouldn't be this way, that people are fearful of getting the HPV vaccine for their children or getting the Hep C vaccine for themselves. So our two spokespeople, Alejandro Escobedo is a singer-songwriter who's been working with us for, I think, 4 years, and he's Hep C cured, and he's an evangelist for this message. And then this year we started working with Ernie Hudson, who, as you probably know, an actor, one of the original Ghostbusters. And he is a 2-time cancer survivor. He gives early detection the credit for the fact that he's still alive for his children and his grandchildren, and he even has great-grandchildren, we learned. So think about the link is the name of this program. It's, as I said, a public education program. We've worked with Scholastic Magazine, for example, to get the word out to parents. And it also has had its fair share of media attention, media coverage. So the numbers are going up. They're not going up as fast as we wish, but they are increasing. And then finally, in response to, the next slide, please. In response to the unfortunate increase in young onset colorectal cancer, we developed a campaign called Too Young for This. It's censored, but you can see what the last word is. And this is for young adults. And we thought, if we're going to educate them, we have to talk the way they do. So it's a very edgy campaign, but it's also gotten a lot of pick up. And particularly when Chadwick Boseman died, it just underscored the value of having an educational campaign to teach younger adults who aren't eligible for screening what the symptoms are. So this is, be mindful, watch for these things, and if you think you have a symptom, do something about it. That really is the most important thing.
Yeah, and Bo, I have to admit, I'm sure that there's viewers right now that are looking at this image that reacted the way I did the first time, like, whoa, this is really graphic, and it's actually uncomfortable. It's not something you see in most presentations, but again, it reminds me of something I said, and I was part of a advisory board for health equity, and I said we have to sometimes get uncomfortable, get comfortable being uncomfortable. So like whether it's the verbiage that you use or this imagery, it is uncomfortable, but we have to just get past it so that there can be a cure. So again, Bo, thank you for doing this, because I'm sure that this didn't get an immediate check off,
Right.
But
absolutely,
it's certainly memorable. So thank you.
Well, thank you. And I think that's my last slide, if I'm not mistaken. If I could have the last.
Oh, you can please share that too, Bo.
Do you want me to show it? All right, we did a report card called Gut Check, and we went state by state and looked at the numbers of young onset colorectal cancer in each state, and have distributed the report card to each state. So that's just another example of responding to the moment. I mean, this young onset colorectal cancer is on the rise, and we wanted to sensitize state health departments to the fact that they need to be more mindful of this. And then my final slide, so that I can give this back to you, Rose, comes back to our theme. We do dare to imagine a world where no one dies of cancer. Do you? We hope so. Thank you so much for this opportunity, Rose.
Thank you. Thank you, Bo. I knew that you would be absolutely incredible and so knowledgeable. And just a little personal note, and I would try not to get too gushy, but you're always going to have a special place in my heart, because now, CO is this huge, large organization. People know who we are. But when I was hired over a decade ago to start CPAN, and we had our very first conference and a couple of early events, nobody knew who CPAN was or what we were trying to be, COA's Patient Advocacy Network. I reached out to you to be one of our speakers, because even though I was trying to get a new organization off the ground, you had been doing this for a while and had such a great reputation, and you said yes, and you've always said yes to anytime we reached out. And I really admire you and respect you, and thank you for your personal work that you've done. And even you took a time of sadness with the loss of your dad, and you've turned it into this incredible organization that literally has a community and a global impact. And if you could just say one more thing, Bo, about your 4 pillars, and then tell people your website address so they can learn more.
Oh, of course. I'm always happy to have that chance. So we have said from the get-go that the 4 pillars that are what we rest on are research, education, community outreach, and advocacy. And you've seen examples really of all 4 of those, but I'll just say one quick thing, and that is that over the last 35 years, we have funded, with a peer-reviewed grant-making process, we have funded more than 500 grants in this country, as well as I think we're up to about 25 global grants. So we really believe in living and practicing what we preach. And if we say our 4 pillars of research, education, community outreach, and advocacy, you've seen examples of how we go about doing all that.
There's nothing I love more than people who walk the talk, Bo, and you sure do.
Thank you. Yeah, our website is www.preventcancer.org. So it's pretty easy to remember.
Thank you again. We have one last slide. Drew, if you can please advance it. Thank you again, Bo, and thank you to all of our listeners for spending your time with us. Next month, and it's a perfect segue into the talk that Bo gave us today, is we're having our very first disease-specific speaker, and this is Cindy Barassi, who is the interim executive director from the Colon Cancer Foundation. And a quick little FYI, and it's still related to Bo's great work, as I was doing my research for my next speaker, because I like to start early, I discovered that Bo's organization was the organization that first declared a colorectal cancer month. So Bo, your impact is everywhere. Thank you, everyone, and enjoy the rest of your day. Thank you again, Bo. Thank you.
Thanks so much, Rose. It was a pleasure.